Do you have CrossFit patients with shoulder pain that doesn't improve, even though they have strength and no structural injuries present? In that case, perhaps the problem isn't in the tissue, but rather in how the neuromuscular system controlling that shoulder is organized. With non-specific shoulder pain in CrossFit athletes, load isn't always the main factor. Very often what fails is scapular coordination, neuromuscular control, and the system's ability to regulate muscle tension after fatigue. That's why some shoulders can't tolerate more load, even if the patient's strong. The problem isn't just how much the muscle can contract, but how the body is organized to produce movement. A study carried out with 40 CrossFit athletes without any known structural injury analyzed the effect of a single session of peripheral electrical neuromodulation on mobility, strength, and scapular motor control. Although these athletes were considered healthy, many showed measurable alterations: loss of internal rotation mobility, deficits in internal and external rotation strength, inhibition of the lower trapezius and serratus anterior, and overactivity of the upper trapezius. In other words, shoulders that move but with a poorly organized pattern. The intervention consisted of a single session of peripheral electrical neuromodulation on the axillary and suprascapular nerves using biphasic stimulation. 10 stimuli at 10 seconds each, with 10-second rests, a pulse width at 240 microseconds, an intensity sufficient to produce a painless contraction, and a frequency at 10 Hz. What happened after that single session? Mobility was the first variable to respond. Internal rotation of the treated shoulder increased, the total range of movement improved, and changes were even observed in the untreated shoulder, suggesting a possible central modulation effect. As for strength, the changes were more limited. Mainly, external rotation improved, but the ratio between external and internal rotation was not normalized. This leaves a clear idea: neuromodulation does not replace training, it prepares the system so that training works better. The most relevant result was scapular motor control. Neuromodulation managed to reduce activation of the upper trapezius, a muscle that is often overactive in athletes who perform many overhead movements. That hyperactivity can compete with the lower trapezius, the serratus anterior, and the infraspinatus, worsening scapular mechanics and increasing the risk under fatigue. That's why reducing the noise from the upper trapezius creates a window for re-education. First you modulate, then you train. And when you train in that state, the exercise is more likely to activate the right muscles. This is where EMG changes the way we work. Before neuromodulation, you can measure the activation of the upper trapezius, lower trapezius, serratus anterior, and infraspinatus during reference exercises. Afterwards, you repeat the assessment and check whether the upper trapezius decreases and whether the stabilizers respond better. During the subsequent exercise, you can use real-time EMG to choose which exercise best activates the lower trapezius, serratus anterior, or infraspinatus, with as little interference as possible from the upper trapezius. You don't choose by intuition, you verify with data. In summary, non-specific shoulder pain in CrossFit often has a neuromuscular component that neither imaging nor strength can fully explain. A shoulder with an overactive upper trapezius, inhibition of the lower trapezius, and a deficit in scapular control does not improve simply by adding more load. Neuromodulation can help to reorganize that pattern, improve mobility, and open a window where exercise has a greater impact. An EMG allows you to cheat this, choose exercises more effectively, and demonstrate progress with objective data. You treat, measure, and train from the very first session. Click here, request information, and learn how to use EMG together with neuromodulation to improve scapular motor control in your patients with shoulder pain.